It's a wired world, which can be both a blessing and a curse for dental practices. The blessing is that there are more ways than ever to communicate with and attract new patients. Now, the curse is that there are more ways for unhappy patients and prospects to air those grievances in public. The vast majority of your prospects will check one or more review sites before making a decision about choosing your practice. Your online reputation is a make or break aspect of your marketing. When we come back, I'll tell you how to handle bad online reviews. Stay tuned. I'm Colin Receiver, CEO of SmartBox, and thanks for watching the Patient Attraction Podcast. Now, there was a time when the only bad publicity dentists had to fear was the word of mouth, or maybe a letter to the editor in a newspaper. Now, those were real and serious concerns in smaller markets, but less so in larger ones. Today, though, every person with an internet connection has a soapbox that can potentially reach every one of your prospects. Reputation management for dentists is a very hot topic these days, and for good reason. According to some estimates, over 90% of people now read online reviews. And another source says that people trust online reviews just as much as they trust word-of-mouth recommendations. So, online reviews are today's word of mouth, but with a much broader reach than ever possible before. Dentists really need to pay attention to the reviews of their practice on Yelp, on Google, on HealthGrades, and other well-known review sites. Now, there are two aspects of online reviews that matter to your practice. That's the reviews themselves and the star rating given by the reviewer. Patients and prospects who complain online about you or your practice run the gamut from reasonable to ridiculous. Now, reasonable complaints often center on scheduling issues, financial concerns, or quality of care. Unreasonable complaints might include relatively minor things, such as the comfort of your dental chairs or the type of floss your hygienists use, believe it or not. Every complaint needs to be taken seriously because a handful of negative reviews can have profound consequences for your practice. Now, to borrow a phrase, it doesn't take much poison to poison a well. Every negative review is a potential forget it from your dental prospects. The second aspect of reviews, the star rating system, is just as critical. If you have hundreds of 5-star reviews, a few low ratings won't move your overall score. But if you only have 1 or 2 dozen ratings, and a few 1-star ratings can drop your score significantly. All things being equal, prospects will choose the practice that has 4 stars or higher. The star rating is the most important factor that influences your prospects' decisions. It's a quick and easy snapshot of your practice, and oftentimes the first thing the prospect sees when they look for you. Now, preventing online complaints is clearly one of the best and important strategies. Having clear written policies in place and shared with all new patients helps to set those expectations up front. Ideally, any patient dissatisfaction can be dealt with before that patient ever walks out your door. But many people won't complain on the spot, so you have to be ready when those complaints surface online. All in all, the worst thing you can do is ignore complaints, because when you ignore them, they become unanswered public indictments of your practice. You should already be engaging the people who comment on your practice online. You have to engage the people who make negative comments as well. You're generally safe repeating your commitment to patient satisfaction and inviting that complainer to contact you directly offline. Now, it's vital to avoid any indication that you're arguing with or attacking the reviewer. Once that conversation has moved offline, you can address the issue to the extent allowed by your state laws and hopefully reach a resolution. As a last resort, the Consumer Review Fairness Act does allow you to prohibit or remove certain online reviews. Consult the Act or your attorney for guidance. Join me for our next podcast. Until then, keep moving forward.